In this video, we're going to look at the benefits of vitamin D for sleep and mental health. It can be really confusing when you're at the grocery store, standing at the vitamin section, and there's all different kinds of vitamins and supplements. It can be pretty overwhelming to know what you actually need and what all of these vitamins are for. So in this video, we're going to start by looking at vitamin D. And if you ever feel like that when you're standing at the grocery store in the vitamin section, go ahead and subscribe to my channel so that you can keep on learning about sleep and mental health. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. This channel is all about science-based, holistic ways to optimize your sleep and mental well-being. And before we jump into this video, I'd like to invite you to go ahead and grab my free holistic sleep guide. The guide is available on my website at intrabalance.com/sleep guide, and the link is also available in the video description. First of all, what is vitamin D? Vitamin D is a fat-soluble vitamin that is found naturally in some foods. It's also added to certain foods, and it is available as a dietary supplement. Vitamin D is also produced naturally or endogenously by your body. This happens when sunlight hits your skin, and that UV exposure actually then triggers your body to produce vitamin D. What does vitamin D even do? One of the things that it does is it helps your body absorb calcium, which is necessary for strong bones. Together with calcium, vitamin D helps to maintain your bone strength, and it helps to reduce the risk of osteoporosis, which is a disorder in which the bones become more thin and more weak and more prone to fracture, meaning they're more likely to break. In addition to helping your body absorb calcium and maintain bone health, vitamin D helps your body to absorb magnesium and phosphate and iron and zinc. Vitamin D helps your muscles to move, and it helps to carry signals between your nerve cells. Having adequate vitamin D helps to reduce muscle cramps. Vitamin D is also really important for your immune system so that your immune system can fight off viruses and bacteria and germs that can cause illness. Vitamin D is also really important for reducing inflammation in the body. It also helps with glucose metabolism, and the list goes on. So vitamin D has a multitude of different functions in the body. So how do you make sure you're getting enough vitamin D? There are a couple of sources to think about. The first are food sources. Now the challenge here is that not a lot of foods actually naturally contain vitamin D. For plant-based sources, mushrooms do contain some level of vitamin D. And then if you take seafood, certain fish are high in vitamin D, like salmon or mackerel. And then there are a lot of foods that are fortified with vitamin D. This includes other animal-based products like dairy or even plant milks if you're on a plant-based diet. These typically are fortified with vitamin D. And as I mentioned earlier, the body produces vitamin D when exposed to sunlight. So when sunlight hits your skin, that UVB radiation helps to convert provitamin D into vitamin D3. People who are older or people with darker skin are not as able to produce vitamin D from sunlight. Also, UVB radiation doesn't go through glass. So if you're getting exposed to sunlight through a window, you're not going to be able to get vitamin D from that because you're not getting the UVB radiation that's necessary for vitamin D synthesis. Now, of course, you want to be careful with sunlight exposure because of the risk of skin cancer. So it's always a risk-benefit analysis here. Because everyone responds differently to UVB radiation and how much vitamin D they're able to synthesize from that, there are no clear-cut guidelines as to how much sunlight people should be getting in order to adequately synthesize vitamin D. So as far as how much sunlight exposure you should be getting to make sure you're getting enough vitamin D, there is no clear consensus. Some experts recommend that getting somewhere between 5 to 30 minutes of sunlight exposure per day, twice a week, or even every day, between the hours of 10 a.m. and 4 p.m. could help make sure that you're getting enough sunlight exposure so that you're getting enough vitamin D. But again, you need to be careful with getting sunlight exposure without wearing sunscreen because of the risk of skin cancer. So do talk to your doctor about what strategy would be best for you. Now, back to the grocery store. So you're standing in front of the vitamin section and you're seeing all these different kinds of vitamins. You'll even notice that there are different kinds of vitamin D supplements. You might see that there are vitamin D2 supplements and also vitamin D3. Both forms of vitamin D2 supplements and vitamin D3 do help to increase vitamin D levels in your blood, but it's thought that vitamin D3 helps to increase the levels more rapidly and also maintain your vitamin D levels for a longer period of time. Now remember that vitamin D is a fat-soluble vitamin, so it's better absorbed when taken with food or a light snack that does contain some fat. And as far as how much you should be taking, the recommended dietary allowance is around 600 IU's per day, but again, do talk to your doctor about your specific needs. Now it is possible to take too much vitamin D. You actually can get your levels checked through a blood test. Levels of 50 nanomoles per liter are sufficient for most people. There's more research going on to figure out what levels of vitamin D are actually optimal for different populations and also for certain medical conditions. The Endocrine Society suggests that levels of 75 nanomoles per liter are optimal. If this type of information is helpful for you, please go ahead and say yes in the comments and let me know. How does vitamin D affect sleep? There are some preliminary studies showing that vitamin D deficiency, or at least low levels of vitamin D, are associated with shorter sleep, so not getting as much sleep, lower sleep efficiency, and poor sleep quality. And why this might be is that vitamin D is involved in a number of different regions of the brain that also help to regulate sleep. It's also thought that vitamin D might play a role in some of the genes that regulate the circadian rhythm, or the body clock. Now, this is an emerging area of research. There aren't really any clinical guidelines suggesting how much vitamin D you should be taking if you are experiencing sleep issues or if you are simply looking to optimize your sleep. And as far as mood, vitamin D is shown to play a role in various brain processes, and there are also vitamin D receptors in areas of the brain that are known to be involved in the pathophysiology of depression. But the same kind of recommendation goes that we don't really have any studies showing that there are specific optimal levels of vitamin D for depression or that you should be taking vitamin D supplements for depression. The research simply isn't there yet. So as of right now, there aren't any studies showing that taking vitamin D alone as a supplement is an adequate treatment for depression. But again, if you are experiencing depression or sleep issues, it is worth having a conversation with your doctor to see if vitamin D might be an important or useful part of your treatment plan. If you found this video helpful, go ahead and subscribe to my channel so you can keep on learning holistic, science-based ways to optimize your sleep and mental wellness.